Hey everyone, I'm Dr. Alyssa, pelvic floor physical therapist and co-owner of Renew Health. Today we're talking about something that affects literally every woman who goes through perimenopause and menopause. Somehow no one is talking about it. Let's talk about how perimenopause and menopause completely change your pelvic floor. If you're in your 40s or 50s and suddenly you're dealing with leakage, for example, when maybe you never did before, or you did experience leakage before in your 20s and 30s and now it's just getting worse, this is for you. Or if you're feeling heaviness or pressure down in your pelvic floor, or now sex is suddenly painful, you're not alone, you're not broken. There are definitely solutions to all of these problems. By the end of this video, you're going to understand exactly what's happening to your pelvic floor during these transitional times, why it's happening, and what you can actually do about it. Let's dive in. First, let's talk about perimenopause and menopause and what it actually does to the pelvic floor tissues. In these situations, estrogen is the key player. Your pelvic floor tissues, the muscles, connective tissues, the vaginal tissue, even your urethra, all of it have estrogen receptors. That means that these tissues and structures rely on estrogen to stay healthy, strong, and elastic. When estrogen is changing during perimenopause, in your early 40s or even in your late 30s for some women, then significantly drops in menopause, here's what's actually happening. The vaginal tissue gets thinner, drier, less elastic, there's less blood flow to the area. Estrogen helps maintain collagen in your connective tissues, so when estrogen drops, you lose that collagen. This means that ligaments, fascia, the support for your pelvic floor becomes compromised. This is why prolapse risk, for example, significantly increases after menopause. Your pelvic floor muscles can lose tone and coordination as well. Let's talk about the symptoms that women are experiencing during this transition that they don't often realize are pelvic floor related. We often see folks struggle with what's called stress urinary incontinence or leaking with coughing, sneezing, running, jumping, laughing, yelling at the kids. You might have never leaked in your life. Suddenly in perimenopause, you're crossing your legs when you sneeze, or you are suddenly feeling like you need to pee all the time. You may be waking up multiple times in the middle of the night, feeling like you can't make it to the bathroom fast enough. We call this urge incontinence. This matters because as we age, our risk of fall significantly increases if we are incontinent. If we are waking up multiple times in the middle of the night to go to the bathroom, our fall risk is going to significantly increase. Another symptom is painful intimacy. This is a big one for folks. Vaginal dryness is the most obvious symptom, but it goes much deeper than that. The vaginal tissue is thinner, less elastic, more prone to this micro tearing. The pelvic floor muscles can become tighter and more reactive because they're trying to compensate for the loss of tissue support. This can create an environment where any sort of penetration is painful. Pelvic organ prolapse or worsening of prolapse is another common symptom that we see in this time frame. That feeling of heaviness, pressure, bulging in the vagina, feeling like something's falling out. This happens because the connective tissue support weakens with estrogen loss. The pelvic floor muscles and truly the rest of the body try to compensate. What's frustrating is that women might go to their doctor with these symptoms and they're told that's just part of aging, or you've had kids, what do you expect? Or just do more Kegels. They never actually get to the root cause. Very rarely are they referring to pelvic floor therapy. What can you actually do about this? If you've been experiencing vaginal dryness, painful intimacy, urgency, frequency, recurrent UTIs, talk to your doctor about vaginal estrogen. Vaginal estrogen restores tissue health, improves elasticity, can help reduce pain with intimacy, can significantly improve urinary symptoms. Go to pelvic floor physical therapy, the kind that actually gets you better. Here's the thing, not all pelvic floor PT is the same. Make sure you find a pelvic floor therapist who goes beyond Kegel-based care. You might not need to strengthen your pelvic floor. In fact, a lot of women in perimenopause and menopause have pelvic floors that are too tense, not too weak, or they're just poorly coordinated. Doing more Kegels in that situation may certainly make things worse. The other thing that you can get started on is strength training and load management. Maintaining muscle mass and bone density through strength training is critical for pelvic floor health in menopause. When you lose estrogen, you lose muscle mass and bone density rapidly. Strength training helps counteract this. If you're struggling with pelvic floor symptoms, it's important to see a pelvic floor therapist to get started on the right path. This is where working with someone who understands both strength training and pelvic health is key, because we need you to be jumping. We need you to be strength training, particularly as we get older. We don't want pelvic floor symptoms to be a reason you can't. Now let's talk about what doesn't work, because there's a lot of misinformation out there. Kegels are not a universal solution. If your pelvic floor is already too tense, doing more Kegels can make that worse. If you have a prolapse and you're trying to do Kegels in a way that's like bearing down, you're potentially making that prolapse worse. Get assessed first. Truly, the entire body needs to be assessed, from rib cage position to foot and ankle mobility. Staying inside of the pelvis is the easiest way to miss the boat on solving someone's complex pelvic health concerns. Another mistake that we see too is ignoring symptoms and hoping that they go away. Unfortunately, pelvic floor symptoms, especially in perimenopause and menopause, they don't typically get better on their own. The tissue changes are progressive without intervention. Vaginal estrogen cream, pelvic floor PT, talking through lifestyle modifications can significantly improve your symptoms. The key here is you actually have to address it. It doesn't go away on its own. We don't want you to accept that this is just part of aging. Your pelvic floor changes with age and hormones. Suffering in silence, avoiding exercise, stopping activities you love, dealing with painful intimacy, or wearing pads every day is not normal part of aging. That is pathological signs of aging, not normal aging. And these symptoms are all treatable. So if you're experiencing any of these symptoms, find a provider who takes you seriously. Find a pelvic floor PT who specializes in perimenopause and menopause. Find a gynecologist or menopause specialist who will potentially prescribe topical estrogen cream if it's appropriate. You truly deserve to move through this stage of life feeling strong, capable, and comfortable in your body. We want folks to be thriving during this time, not just surviving. If you found this helpful, please share it with women in your life who need to hear this. Thank you for watching this video. We'll see you in the next one.